All right, hello everyone. Welcome to the 2020 Alumni Fellows presentation, Conversations with OSU Influencers. My name is Tiffany Tep and I am a student in the Honors College as well as the College of Science. Today we'll hear from the Alumni Fellow Dr. SreyRam Kuy, who will be introduced by Toni Doolen, the Dean of the Honors College. On behalf of all of us today, I'd like to thank the Alumni Association for producing this webcast and establishing the Alumni Fellows program. After the presentation, please join us for a question and answer session. Please submit your question by using the Q&A box at the bottom of your browser window. This presentation is being recorded and will be posted online at osualum.com/fellows. Please welcome Toni Doolen to introduce our OSU Alumni Fellow, Dr. SreyRam Kuy.
Thank you, Tiffany, for the introduction. It is now my tremendous pleasure to introduce Dr. SreyRam Kuy as the 2020 Oregon State University Honors College Alumni Fellow. SreyRam's story is not just a great OSU story, it's a great American story. She and her family risked their lives to come to the US when she was 2, fleeing the genocidal violence of Cambodia. Eventually, they ended up in Corvallis, and in 1997, SreyRam came to OSU and became one of the very first Honors College students, just 2 years after the college's founding. She graduated with degrees in microbiology and philosophy and went on to earn her MD from Oregon Health and Science University and a Master of Health Sciences from Yale University School of Medicine. SreyRam quickly emerged as a leader and an innovator in healthcare policy. By 2016, she was the Chief Medical Officer of the Louisiana Department of Health and Hospitals, leading the state through a range of crises from the opioid epidemic to Hurricane Harvey, experiences she will share with us today. She then became the first woman to be appointed Deputy Undersecretary for Community Care in the U.S. Department of Veteran Affairs. She is now the Deputy Chief Medical Officer for the Quality and Safety in South Central VA Healthcare Network. It would take much longer than a few minutes that I have to list the many recognitions and awards that SreyRam has received throughout her career, from the L'Oreal Paris Women of Worth Award to becoming one of just 21 healthcare leaders to earn an Aspen Institute Health Innovators Fellowship in 2019. Impressive as these are, and they are very impressive, it is her personal qualities that make her such an exemplar of everything we hope the Honors College at OSU stands for, and such a worthy fellow as we celebrate our 25th anniversary as a college. Whether it's taking time to meet with individual students or taking on a major healthcare challenge of our time, SreyRam is committed to serving others, to bringing her many talents to bear on making positive changes in the world around us. Just as the topic of her talk, Leading During a Crisis, feels so very relevant now, her commitment and compassion is a welcome inspiration for all of us today. Please join me in welcoming Dr. SreyRam Kuy, the 2020 Alumni Fellow for the Oregon State University Honors College.
Thank you, Dean Doolen, and thank you, Tiffany. It's a very kind introduction, and it's such an honor to be named an Honors College Alumni Fellow. And I also want to say thank you to Oregon State University and the OSU Honors College. I am so grateful for the education I received here, the lessons I learned, and the teachers who mentored me during my time at OSU. And I'm so proud to be a part of the OSU family, so thank you very much. And I have a long history with OSU. As Dean Doolen mentioned, after my family and I escaped from the Cambodian genocide and the killing fields, we arrived here in Corvallis in 1981. My parents took whatever jobs they could, and they were just grateful to be able to work and to live as free Americans. It was a huge blessing. One of my mom's first jobs in the US was actually working in the horticultural greenhouses here at OSU before later taking a job as a housekeeper at Good Samaritan Hospital. And my father worked as a janitor here at OSU, cleaning the classrooms. And I remember at nights after school, both my sister and I, we would walk with my parents to the OSU Folk Club thrift shop. And we cleaned the shop in the evenings as our family's second job. And I remember growing up in Corvallis, I'd go with my mom and my dad, and we'd do yard work and clean houses for doctors at Good Sam and the OSU professors. And so I tell the story because as I was growing up, in so many ways, OSU and the community of OSU has been a huge part of my life. Several years later, when I was a senior in high school, I was accepted to Harvard and offered a scholarship. However, at that same time, my father was diagnosed with cancer and he died that spring. And I still remember, like it was yesterday, coming to OSU that spring of 1996, and I was sitting on the steps of the Strand Ag Hall. And I remember sitting on the steps of Strand Ag and writing down what I wanted to accomplish in my life. And I decided, instead of Harvard, I was going to come to OSU so that I could continue to help my family. And now, looking back more than 2 decades later, that was one of the best decisions I made. I think when I tell a story, what really stands out for me is that there are certain moments in our lives during the deepest crises that we face when it really crystallizes as to what's important and what's not. And that also is the crux of leading during a crisis, knowing what's important and what's not. Leading during a crisis is like leading in the fog of war. Through my various leadership roles in emergencies, such as the Zika outbreak, the opioid epidemic, the Great Flood in Louisiana, Hurricane Harvey in Houston, tackling a workforce crisis in DC, or responding to the COVID pandemic, what I've seen over and over again is that at that crisis, during that time, leaders oftentimes don't have the luxury to spend lengthy time methodically going over the different facets of a problem. Yet, at that same time, lives depend on our success, and trial and error is not an option. During a crisis, just like during a battle, leaders need to be able to slice through the fog of misinformation and multiple different tangents and rapidly get to the heart of the matter and know what is important and what's not. And so I think what I've learned from my experiences is that the 3 key things that a leader needs to know during a crisis, and you have to be able to do rapidly, is 1, assess your organization's preparedness for that crisis. 2, identify your organization's areas of weakness. And 3, strategically target resources for the greatest impact. And it doesn't matter whether you're looking at the Zika epidemic or the COVID pandemic, or you're responding to a flood or a hurricane or a huge uptick in medical errors. These same 3 principles hold the same for any leader tackling a crisis. For example, when Hurricane Harvey hit Houston, we had less than a week's notice to prepare. At that time, I was serving as the Associate Chief of Staff for the Houston VA Medical Center, which with 5,500 employees was one of the most complex and one of the busiest VA medical centers in the country. We were serving veterans not only in Houston, but also in the 27 surrounding counties. We had days, not months, but days to rapidly prepare for what would be one of the greatest natural disasters to hit Houston in recent history. We didn't know at that time that Hurricane Houston was going to dump 127 billion tons of water on Texas in a matter of just days. All we knew is that the hurricane was going to be hitting the Gulf Coast and Houston was in its path. There was so much uncertainty as to whether it would die down or whether it would worsen. But as a leader, uncertainty is not an excuse. So what we did was we assessed our medical center's preparedness for the hurricane. We identified our areas of weakness, and we strategically targeted resources to have the greatest impact. Putting this into practical terms, what that meant is that we assessed that if there were going to be significant roadway problems, such as if there was flooding or hurricane winds, and our staff, those being like our nurses, our doctors, our technicians, our janitors, our electricians, all the people that keep our hospital running, if they were not able, because of roadway problems, to get into the medical center or to leave the medical center, then they would not be able to help us continue to care for our patients. We also assessed that if we lost power, ventilators would not be able to function and support our critically ill patients who were intubated. We assessed that if there was infrastructure damage to the hospital and patients needed to be evacuated for their safety, the fact is all our patients' records were on electronic medical records. And being that way, as during an evacuation, it would be very difficult to access their important medical information, their medications, the drips, the IVs they were on in real time, as you normally do caring for our patients. We assessed that we were going to have to make sure we could take care of our veterans, our patients, not only in Houston, but in the surrounding 27 counties across the area. And many of those would likely end up in flood shelters if their homes were destroyed, or would not be able to make it to the VA to get care that they needed because of roadway closures. So having assessed the preparedness, having assessed our weaknesses, we started putting into action and strategically targeting our resources. First thing, we asked our staff to do something that was just really difficult, but they rose to the task. We asked our staff days ahead of the hurricanes to be prepared to hunker down in the hospital. Because if they left the hospital after their shift ended and roadways were closed, they wouldn't be able to make it back for their next shift. So over the course of the hurricane hitting and in the devastating flood aftermath, nearly 700 staff stayed on site at the hospital to care for the 400 employees, patients, because that's how many staff it takes to run a hospital and critically ill patients. So taking turns sleeping on cots that we set up in the auditorium or sleeping on floors in their offices, all of these staff stayed on site. And for the next several days, our staff were watching the news on the TV and seeing their own neighborhoods flooded, talking on their phone and with their family members and hearing about their own family members seeking emergency shelter at the emergency auditorium setups for the floods. Some of them even stayed in the hospital for 6 days straight throughout the hurricane and the flooding, and they made extraordinary sacrifices. And I am so proud of them and so proud of our team. In addition, as a leader, if you're going to ask your team to make extraordinary sacrifices, you have to demonstrate that you're going to be there alongside them every single step of the way. I and many of the other leaders at the medical center, we stayed on site at the hospital, sleeping on the floor in our offices. I remember rounding on throughout the hospital, in the dialysis unit, in the medical ICU, in the critical care, on the surgical wards, and just talking with the team members, with the staff, and asking them, how are you doing? What do you need? How are you hanging in there? And what I heard back was they were just glad that people cared and that people were listening, and they gave practical input, like we needed the canteen open so they can buy basics like deodorant and socks, things that they didn't have after 5 and 6 days. So I think the key point from that is if you're going to ask your team to make sacrifices, you have to be there alongside them in the trenches. And as we mentioned earlier, as we're prepared for the fact that patients may have to be evacuated or we might lose power, what can we do? And so in terms of targeting our resources, this was led by our nurse executives. I'm so proud of our nurse teams for doing this. They printed out the medical charts and medication lists for the patients and put them into waterproof packages that was placed with every single patient so that if they had to be evacuated immediately, it was available. If we lost power and we couldn't access our electronic medical records, they had on those printed hard copies the exact titrations of the IV drips and what medications they needed and what schedules. That took an enormous amount of effort from all the nurse team members to go ahead and prepare strategically like this. As I mentioned, we were concerned that if we lost power, our ventilators wouldn't function. And if our generator or backup generators didn't function, again, we'd worry about those who relied on their ventilators. So we made sure that by every ventilated patient at the bedside, there was a small portable battery run ventilator that would be ready to turn on immediately if if the generator and the power went out. So we always had a backup plan for everything. And then, as I mentioned earlier, we take care of patients beyond just Houston area in the 27 counties surrounding the area. As soon as the waters receded and we were able to actually physically leave the VA Medical Center, I was tasked by the medical center to go to the emergency flood centers. These were auditoriums like NRG and the George Brown Center. These were auditoriums that had been set up by the county and the state and FEMA to provide housing for those who had lost their homes during the flood. And what we did is we brought primary care providers, we brought mental health providers, social workers, and laptops with our medical records there. And this was critically important for the population we were taking care of, because many of the veterans that we take care of have PTSD, they have challenges with depression or mental health, and with extremely complex medical records, histories. It's so important to know their history, as well as the medications and the regimen and the therapy they're on, and triggers and the increased stressors of the hurricanes oftentimes exacerbates these conditions. So we were able to bring in not only providers of our own who understood the needs of our veterans, but also their medical records so that they could so they would not lose continuity of care for their health issues. We also worked to bring a mobile medical unit to the outlying areas, so veterans who could not make it into the medical center in the city would be able to get care. And oftentimes the care they needed were primary care, mental health, and social work, as they were struggling to recover and survive the aftermath of the flooding. So I think what we learned from this, that we did a lot of great things that I'm really proud of. We also learned things that we could do better in the next time. And throughout my journey in healthcare leadership and health policy, I hope that each time we learn from each iteration of a crisis so that we can do better and better, and to try to bring those ideas together to help other healthcare leaders and during a crisis. And then in January of this year, 2020, we started hearing about the coronavirus. When we started hearing about it, I realized it was just a matter of time before this would become a global pandemic, because it was so easy to travel by plane as a respiratory illness to spread so rapidly across continents. So what we did is we convened healthcare leaders early on from across the country. Some of these were doctors working in rural America, in San Bernardino, in rural Texas, and some were from Johns Hopkins and Emory and George Washington. We were bringing healthcare leaders who were on the front lines and just beginning to see COVID and the impact it was having. And we brought together the best practices that they were seeing in real time, what was working, how to screen, how to prevent transmission, how to conserve resources, such as stopping elective procedures so that we could conserve nurses and technicians to take care of ICU units. And together we were able to create a best practices guidelines early on in the spring, and to be able to share it through New England Journal of Medicine Catalyst as a venue to help other healthcare leaders and organizations adopt these early on. At that time also, I had been working with the Aspen Institute to develop leadership tools to help leaders during crisis. And my focus at that time had been like natural disasters and upticks in safety errors and things like that. But in January, hearing about the COVID cases coming out, we pivoted to seeing how can we use these lessons learned from all these different emergencies and crises to help leaders respond to the COVID crisis. So we created an online tool that took many of those same principles about assessing your preparedness, identifying your areas of weakness, and strategically targeting your resources to create a rapid online tool that not only healthcare leaders, but leaders in any non-healthcare organization could use to assess their organization and their preparedness. I was fortunate enough to be able to work with the CEO of Get Well Network through the Aspen Institute to deploy this to hospitals and clinics across the country through their platform. And I'm so grateful to my good friend Mike O'Neill, the CEO of Get Well Network, who offered this for free as a sort of resource to help organizations across the country. So in summary, I think the key things for every leader facing a crisis to remember is cut to the chase of it, cut to what is the most important things and what's not important. And what that means is assess your organization's level of preparedness, assess your organization's areas of weakness, and strategically target resources for greatest impact. And I've found that these three key principles hold true, whether we were tackling the opioid epidemic in Louisiana or the Zika outbreak hitting the Gulf Coast, or Hurricane Harvey, or working to improve workforce challenge in DC. Regardless of this, if you keep these three key principles in mind, then you're able to really cut through the fog of misinformation and know what are the key areas to focus on. And so in summary, during a crisis, just like in a battle, leaders must be able to slice through the fog and identify what's important and what's not, and to do so rapidly. So circling back to the story that I told you about my history with OSU, I tell this story because I feel like OSU has been a part of my story for as long as I can remember. And one of the biggest lessons I learned at OSU was to know what's important and what's not. And for me, I knew that my family was most important. And I knew that if I kept my priorities at the forefront, everything else would work out. And it has. And I'm so grateful for the journey I've had in healthcare leadership and in health policy. And I owe it to the fundamentals I learned at OSU. Thank you.
Thank you, Dr. Kuy, for the wonderful presentation. It is now time for questions and answers. So if you have a question, please type it into the Q&A box in the bottom center of your browser window. So while our audience is typing in their questions, I have one to get us started. So for many college students like myself, we are currently studying in a crisis and working towards building our careers while in a pandemic. So what words of wisdom do you have for students, especially those pursuing careers in healthcare?
That's a very good question, Tiffany. You guys are in an unprecedented time. This is like something that none of the generations before have seen. But I think that if you remember that you're here for a reason, you're here because someone thought you were smart enough, talented enough, important enough to be a part of this community, to be a part of the OSU family. Remember that you're here because you belong. And that gives you then the confidence to go out and be bold, to go out and do the things that make a real difference and to make a change. So I always tell myself that every challenge is an opportunity, and never let any challenge go to waste. Any challenge is an opportunity to make things better, to make an improvement. And so I'll give you an example. When I was serving as the Chief Medical Officer for Louisiana Medicaid, I had just started new in that role. And one of the things I was tasked to do was to tackle the opioid crisis. And Louisiana has a lot of challenges. We have one of the highest rates of opioid overdose deaths and one of the highest rates of opioid prescriptions at that time. We actually had more opioid prescriptions per capita than people in the state, and that's counting babies and children. And when I first started looking at this, there were just so many obstacles. It just seemed insurmountable. But that was an opportunity to make a real change, and a real change that was lasting. And so we were able to implement policy changes and to educate the community and to bring together people from all sides of the political spectrum. When they realize that this is something that's killing people, it doesn't matter if you're a Democrat or a Republican or an independent or a libertarian, opioids were killing everyone. And by bringing everyone to the table, we were able to make real changes. And over the course of a year, we were able to reduce our opioid prescriptions for Medicaid patients by 40%. And the reason why I tell this story is that challenge seemed insurmountable when I started. It seemed like there's opposition from every side. And in the same way, you guys are in the middle of a pandemic. Learning is completely different. You no longer are able to get the things that we were able to do, that we gained from sitting together in closed classrooms and learning together, and so many opportunities have been curtailed. But this is a challenge that I know and I believe that any of you can rise to do great things. You can see the problems and figure out novel ways that only you can think of the solution for.
Thank you. So our next question is from John. What advice do you have for OSU students regarding their current studies and extracurricular activities if they're interested in a career like yours?
Oh, great question. I'm so glad to hear about all these students who are interested in healthcare. I think the world is your oyster. The fact that we're in the middle of a pandemic means that you've opened up opportunities beyond geographic borders. Before, you would have to go somewhere to do an internship. Now you can intern with someone virtually and work on projects virtually. And I think that this again is where it goes back to embrace the challenges, take those challenges and turn them into opportunities. So if you decide that you're interested in doing research in health policy, reach out to someone, look them up, Google them up, find their email and email them and say, hey, I'm an undergrad at OSU and I read about your work. This is really exciting what you're doing. I would love to be involved in some way. And I know I'm still an undergrad, but I have my enthusiasm, I have my strong work ethic, and I have my willingness to do anything to be a part of this. And she would be surprised. There's so many people who want to help young people. People want to help give back because they've benefited in their own way. I know I've benefited from so many mentors and teachers I had at OSU, and I'm grateful for them. And people want to pay it forward. So reach out to anyone that is doing work that you're excited about, and volunteer your time, volunteer your efforts, volunteer your talents, because you have talents that no one else has, and you can do it.
Great, thank you. Our next question is from Kelly, and she asks, what suggestions do you have for students to develop their leadership skills?
Great one. So I feel like I developed most of my leadership skills when I was at OSU, actually. I am by nature very shy and a bookworm and a total introvert. And when I was at OSU, I decided that I didn't want to be that way forever. And I still am at heart an introvert, but I started getting involved with organizations and running for leadership roles. And I'm going to tell you, Tiffany, that the fact is I've actually, when I started running for leadership roles in these elections in student government, I lost more elections than I won. But you know what? I still ended up getting to be a leader in many great organizations. I'm so grateful. I was president for the OSU Habitat for Humanity chapter. I was president for the OSU Science Student Council. I was president for the OSU Phi Beta Sigma, but there's a lot of other groups that I ran for and I lost. But my friends won, my colleagues won, my classmates won. And those are relationships that you build along the way. So I would say if someone is shy and introverted can do it, you can do it too. Just go for it. And what do you have to lose?
All right, thank you. So our next question is from Jesus. And how do you stay mentally fit / relaxed when handling a crisis like the ones you've dealt with, especially now during a time when it's difficult to go out and connect in person with family and friends?
I hear you. It's a very stressful time. It's very it's easy to be overwhelmed by everything that's going on. It's easy to feel like this is never going to end. It's easy to feel the sense of panic, but you center back and think about what's important. If you're healthy, you are doing so much better than many other people during the COVID crisis. If you have family and people who've loved you during your life, you are very blessed. And so I think for me, centering on what's important, that's what I keep saying again, that one of the biggest lessons I learned at my time at OSU is know what's important and what's not. When you center on what's important, then it becomes a lot less stressful, and you count your blessings, and you know how fortunate you are. And knowing that you're blessed and you have these extraordinary opportunities. You're a student at OSU. That's a big deal. Make the most of it. Make the most of your time. Don't let it go to waste. Be deliberate about all that you do.
All right. Our next question is from Sonia. And she asks, one of the big challenges during crises like the two you mentioned is communication. How do you manage and coordinate your messaging so that all staff was on the same page, especially during times when plans are changing constantly? And how did you communicate to patients so that they could easily access resources without overwhelming the staff?
Sonia, that is a huge issue during a crisis, is communicating to your team, to all levels of the organization, from the CEO to the janitor to the supervisors, and communicating to the population that you're serving, in this case, patients, or in an organization, the population is serving. So what we did was we had a command center, a room that we had going 24/7. And this was the hub, the command center, where we would regularly always meet every day, multiple times throughout the day, to get status reports on what's going on in the different areas, where the challenges were, where there was a leak or an electrical issue. And that I think was one of the big ways. But then the messaging out to the team is really important. One, the message needs to show that you have a plan. It needs to show that you know that there are challenges, that you recognize it. It's not a Pollyanna, everything's great. You know that there are challenges, but this is what we're doing to address those challenges. And recognizing that we're not afraid to ask for help. When we were in that 6-day stretch where the Houston VA Medical Center was surrounded by water, literally surrounded by water, and all the roadways were closed, no one could get in. We started running out of food because we were feeding not only 400 patients, but 700 staff there. And I'm so proud of our medical center director, Mr. Vasquez, who reached out, and as a result, he asked for help. And the secretary of the VA made sure that there were these high water trucks that were coming in through the floodwaters to bring in food so we could keep feeding our patients and our staff when no other corps could get through. So in terms of the messaging, it's got to be multimodal. We were sending out text messages down a cascade from the supervisor down to every team member, so that supervisors were knowing, keeping an account of all their team members and reporting back to their supervisors, accounting for each of their staff. We were sending out the emails, we were sending out the messages on the overhead speakers, and we used social media. That's actually how we got a lot of our messaging out to our patients, about saying that we were going to have a mobile medical unit out in the community, so that if you can't come here, we're going to take care of you there. Multiple different, and I think that's the key point that you hit, was it is so important to communicate and to have it be an iterative cycle. So over and over, as things change, that people are updated. Really important.
All right, thank you. So our next question is from Kyle. And first he says, so good to see where you've gone, SreyRam. And then he asks, why did you choose to pursue your career within the VA system?
Well, good to hear from you, Kyle. We were classmates. I've been in the VA system for nearly 2 decades, and starting from when I was a junior medical student. I learned my first heart and lung exam at the VA. I barely even knew what side of the stethoscope to use. And I learned that when I was a junior medical student, just learning my clinical exams. And I continued throughout residency. I was always at a VA system through fellowship. And my very first job out as a staff surgeon was in a small rural VA in Shreveport, Louisiana. And I've seen the struggles, and I remember my very first clinical rotation as a third-year medical student was on the inpatient psychiatry unit at the VA, and just seeing the challenges and the struggles that these veterans had. Many of them were homeless, and often as a result, because this was inpatient psychiatry ward, as a result of the PTSD and depression and struggles they had from serving our country, from serving in war. And it was just so real seeing that. I have a hard time explaining the impact, but it's something I've never forgotten. I think part of it is, I'm really grateful for the freedoms that I have as an American. And I realize that that's not something I was born with. I was born in the middle of a genocide under a communist-led regime, under Pol Pot's Khmer Rouge communist regime. And the fact that I have the freedom to be a doctor when doctors were executed during this genocide, it's something I'm so grateful for. And I'm grateful for the men and women who fought for the freedoms that we enjoy as Americans. So part of that is that I feel a sense of debt and gratitude for the freedoms that we have, and I'm grateful and proud to serve our veterans. And good to talk with you again, Kyle.
Thank you. So our next question is from Regan. And Regan says, according to Wikipedia, you're the first female Cambodian refugee to work as a surgeon in the United States. So what does that mean for you, and how do your social identities show up in your work, or are you impacted by it?
That's a good question, Regan. For me, my story is just a part of me. It's just a matter of fact. I know I was very young when we escaped from Cambodia and we came to the United States, but it's something that my mom's told me often. I remember we were working in the strawberry fields in Oregon, picking strawberries in summer. My mom would tell about the stories about how she survived during the killing fields. And for me, that's just like a part of my being, a part of my fiber, and a part of my purpose for why I do what I do. My life was saved by a volunteer Red Cross surgeon who was working in the refugee camp when my family and I were injured during a bombing when we escaped and were living in the refugee camp. And again, I was very young, but that's just a story that's just a part of me, and it drives what I do. So going back to the first female Cambodian refugee to work as a surgeon, I think that there's a sense of responsibility. I want to make sure that I'm not the only. I want to make sure that there's a legacy that extends beyond me. And I want to be able to make sure that I inspire others, whether you're a young refugee or whether you're, a young person in rural America trying to survive and to struggle and to improve, that I want to be able to inspire people to know that no matter what challenges you face, never think that it's impossible. Never think that you're not worth fighting for, and never think that it will not get better, because I can say from my own experiences that it does get better. And I can say from my experiences that it's worth it to fight and never give up on what your dreams are, on what your hopes are. And I guess for me, it comes down to it's a sense of responsibility to pay it forward, because I've been so fortunate and blessed by so many people.
Well, I will say, as a child of Cambodian refugees myself, you are very inspirational to me, and I'm pretty sure that your legacy will stay with me and with OSU for a very long time.
Thank you, Tiffany.
So one of our listeners is hoping if you could talk about the balance you maintain between patient care and administrative work.
Good question. My first job that first I'm gonna say it's not easy, but if you love what you do, you find a way to integrate it and to do it in a way that makes sense. and so that it becomes effective and efficient rather than when it's silos. My first job out, as I mentioned, as a staff surgeon at the Shreveport VA, which is a very small rural VA in Louisiana. I'd never been to Louisiana before then. And when I took that job at that time, the VA, that hospital actually was struggling. They had quite a lot of challenges around a high rate of mortality following surgical procedures and what we call never events, things like a retained sponge or the wrong side surgery. Things that should never happen, as the Institute of Medicine has said, but still do happen. And they still happen today throughout our country, throughout hospitals across the US. However, this hospital that I started my job at was close to being shut down because of how high the mortality rate was and all these never events of retained sponges, wrong side surgeries. Fortunately, I had a wonderful mentor, my chief of the operative Caroline, Dr. Romero, and he also was a believer in quality improvement and a believer in the ability to make change and make lasting change. And so working with my mentor, Dr. Romero, and the leadership at the Shreveport VA, and I'm very, very proud of how progressive and supportive they were of our efforts. We worked to implement evidence-based strategies around improving quality of care, and particularly we implemented crew resource management, which is a concept used by NASA and the military to ensure safety during high stakes challenges, and creating a culture of safety so that anyone, whether you're a nurse, a medical student, a janitor cleaning the operating room, anyone can speak up if they felt that there was a safety issue. So creating that culture of safety. And over the course of the year, we were able to go from having multiple of these never events, retained sponges, wrong side surgery, to having zero. And we were able to reduce our mortality by about 66%, which was a huge thing. We went from being an outlier for high mortality to being an outlier for low mortality, and this is risk adjusted. So going back to how do you bring it all together? At that time, I was also working full time as a surgeon, taking the same call load as any of the other surgeons, operating the same number of days, doing the same number of clinic days. But because this is something that I really believed in, that I was passionate about, and we were able to get leadership involved, we were able to make it happen. And another one of the areas I'm passionate about is research. And by research, I mean studying it to make sure that what we're doing is right, and also disseminating that information, writing about it, publishing it, so that it's not just a one-off. So it's not just one medical center that improves, but so that we can take these knowledge and these lessons and use it to teach other medical centers, other organizations, so that they can improve the mortality and prevent these adverse events. And so I was able then to tie that work in with my research and to publish prolifically, and to speak about it and to present about it. And that then was how I made my name in quality improvement, and got to the attention of leadership in Louisiana, and later was recruited to serve as the chief medical officer for Louisiana Medicaid, and all started in that work. So going back to how do you balance it all, find what you're passionate about and do that, and it will mesh together. It becomes efficient and it becomes real change.
Great, thank you. So our next question is from Kevin, and he was just wondering if you could talk about the role of mentors in your life.
Kevin, I've had wonderful, wonderful mentors, and I am so grateful for them. So I'm going to give a full disclosure. I never graduated from the Honors College. And I spent nearly 4 years at the Honors College taking classes, and I had to say that some of the classes I took at Honors College are the ones that I remember most, like the Shakespeare in Ashland, and I think I took that like 3 times, and I loved it. But as I was approaching the end of my senior year, I got the opportunity to go and work in DC, to work in the US Senate, and get to work on some really exciting things like the Breast and Cervical Cancer Treatment Act, our Older Americans Authorization Act, these different things. And it meant leaving OSU early and not finishing my coursework at Honors College. And one of my mentors, Dr. Lonnie Roberts, who I'm so forever grateful. She has been so kind, so generous with her time, so supportive. And the reason why I talk about this story is that for her, it wasn't about the numbers, about making sure 100% of students who enroll in Honors College graduate from Honors College, but it's about helping me pursue the dreams that are important and knowing what's most important. And she gave me one of the most valuable pieces of advice. She said, SreyRam, this is going to be something that this is paraphrasing. I can't remember the exact same words, but I remember something along these lines. Dr. Roberts, Lonnie Roberts, saying that this is something that you feel passionate about and that could potentially change your life. Go for it, even if it means kind of dropping out and not finishing the coursework you need for this extra degree. And it's true. That experience, I did that. I dropped out. I never finished my honors thesis. Very embarrassed to say that. I'm telling other students, don't do that. Finish it, get your degree. But I had already learned all those fantastic lessons and valuable lessons that I learned from Honors College. And that experience at that summer, working for Senator Harkin, working on writing speeches on these different policy issues, working on women's health care, that definitely was one of the building blocks that built my career and helped me as I continued building a career in health policy. And Dr. Roberts was just one of many extraordinary mentors I had at OSU. I learned Dr. Flo Leibowitz. She's just one of the most kind and supportive. She's also from the philosophy department. And so many, I mean, the list would go on and on and on. And I think one of the things I would say also is that if you've been fortunate to have all these incredible mentors, people who support you, who support your dream, who see you as more than just a number and do so much for you, do what you can to pay it forward. Find those who might be struggling or those who might have challenges and find how you can help them too.
Thank you. So our next question is from John, and he asked, how can public health officials properly plan and communicate with the public to prepare for disasters without panicking or putting people off?
That's a very timely question. I think sticking with the science, sticking with the hard science, and despite challenges or pushback, having the courage to stand up and stick with the science and the evidence is how we do it. And two, you need to be able to speak it in a language that people understand. You need to be able to get it from the fancy doctor talk, the epidemiologist talk, the public health talk, and relay it in a way that people understand it, in a way that they can relate in their own lives and what measures they need to do to protect their health. And I think third, I would say it's really important to make sure that you have a plan and convey that plan so people don't feel a sense of panic, or they don't feel abandoned, or they don't feel like someone's leading. People, when you can convey, this is a plan, this is what we've developed, and that we're open to changing it as things change, people feel more confident. So I think those three things are the key to communicating effectively with the public during a public health crisis. And that's what we did when we had the Zika outbreak in the Gulf Coast, and Louisiana was one of the states hit there. We worked on messaging that was targeted at the populations that we were really worried about, in particular pregnant women, because if a pregnant woman gets Zika, the impact on the fetus, the child, is astronomical. And we worked on messaging. We worked on developing interventions that fit in with people's lives. We did things like basic things like access to condoms, because Zika is actually a sexually transmitted disease, and most of the public are probably not even aware of that, or access to mosquito repellent, things that on an everyday level people would understand. So those would be my recommendations.
Thank you. So one of our listeners has heard that you are not happy with the way Americans are responding to the pandemic. Do you mind speaking to this?
I don't think I've said that. I think that I think that this has been a challenge, and I think that there have been a lot of people who've really risen to embrace it, to do what they can to make things better. I've seen from my colleagues who are, across in California and LA, working to build a COVID hospital from scratch from an old abandoned building, to take care of patients and putting up these COVID hospitals in the matter of weeks. I've seen doctors in rural Texas who are working to address not only the COVID epidemic overall, but also especially helping those populations that are high risk, like the Hispanic Latinx population, and making sure that the education is in a culturally competent way, that it's in language that it's appropriate. I have been so impressed by so many people who have just gone above and beyond, who are sacrificing their own time, their time with their families, and to tackle this. For instance, my colleague Margaret Lapise, phenomenal. She is my colleague through the Aspen Institute. She worked with an organization in rural California that works with many of the migrant workers living in that area, and that area actually produces most of the fruits and vegetables that we in the US eat. And they've had really high rates of COVID transmission. And so proud of Margaret Lapise and the work she's done to work with the communities and to develop interventions that sprung from the communities, that are based on the community's needs. Such as, for instance, when they had a Mother's Day outbreak from COVID, a string of cases, the community came up with the solutions and learned from that outbreak to educate that area on how to prevent, and they were able to significantly reduce COVID transmission. And the lessons they learned and the strategies and interventions they created are actually being replicated in other counties and communities. So I think that there are a lot of people who are doing phenomenal work, and I'm really proud of them.
All right, thank you. So our next question is from Julie, and she says, Dr. Kuy, you are an amazing example of resilience. How can we advise or help our student and recent grads to develop more grit as they move through the world? What would you tell them?
I think, Julie, that grit is important, definitely. I would say that growing up being the shy bookworm, I was probably very sensitive, probably not that gritty. But one of the things I learned along the way is that don't take it so personally. Remember what's important and what's not. And that in part helped me survive surgical residency, I'd say, because that's pretty, there's some pretty gritty people there. So I think knowing your worth, knowing what makes you unique, knowing what you bring to the table and your talents, that helps you have the confidence to face any adversity, to face any challenge. And that gives you that grit that helps you overcome those obstacles and have that resilience. And for me also, I think I'd have to say my faith and my family has been a large part of what gives me the resilience and the grit. I know that when my relationship with God and my family, that's been a lot of inspiration for me, and during some really challenging times. And looking back, I'm grateful for that. So find what's important, find what really matters, and know your self-worth, and you will develop that resilience.
Great, thank you. So at this time, I'd like to invite Dean Doolen back to ask any more questions.
Thank you so much. And I think we've actually been peppering SreyRam with questions for a couple days now. Those of you in the audience may not know, but she did a forum for our Honors College students earlier this week, and also joined us last spring for another forum about her career path. So we've really appreciated all of the time that she spent with our students in the Honors College. And while you didn't earn that HBS degree, we still consider you one of our most valued alumni. And I just want to take a moment to truly thank you for being so open and sharing your stories, both today and with our students in our last couple Dean and Friend events. And we are extremely proud of you and the impact that you've already had, and we know that you'll continue to have. And so excited that you are our 2020 Honors Alum Fellow. So congratulations and thank you again for joining us. And thank you, Tiffany, for your time today in this busy week 4. And with that, I think we will sign off. So thanks all for joining us.
Yeah, thank you all who joined us today. Join us this week for another great conversation from one of our other alumni fellows. There are presentations happening later today at 2 p.m. Pacific time and Thursday at 10 a.m., noon, 2 p.m., and 4 p.m. Pacific time. Our panel discussion with all 10 fellows and OSU President Alexander is on Friday at noon. The schedule and previously recorded conversations can be found online at osualum.com/fellows. You can learn more about the Honors College and the work they are doing in the community by liking their Facebook page or visiting their website. And Dr. Kuy, I especially want to thank you and congratulate you for being chosen as the 2020 Alumni Fellow.
Thank you, Tiffany. Thank you, Dean Doolen. It's, as I've said, I'm so grateful to be a part of the OSU family. Thank you.
Thank you.
Thank you.
Bye.